Hello, friends. It is August 20th, 2020. This is Leslie, and this is Leslie's Cancer Confessions. Here I've been sharing over the past 9 years my journey living with metastatic breast cancer. I've shared the different types of treatments I've been on, the different types of tests and procedures that I've had, the surgeries, all of it. But today I want to talk about the one experience I haven't had until now, and that is being on a clinical trial. Recently, I began a clinical trial called Trodelvy, which is a medication for a different kind of cancer than I have. That cancer is triple negative breast cancer, and this drug originally became used for colon cancer and then became used for triple negative. And the trial was to see if it would be effective for estrogen receptor positive breast cancer, which is what I have. I did 2 cycles, 4 treatments over the course of 2 months. And then last week I had a CT scan to determine the effectiveness. What they're looking for on those scans is to see if the tumors in my kidneys and in my lungs have receded and shrunk. And in my case, that did not happen. What happened instead is that there are new tumors in my lungs, some small ones, and the 3 tumors that are large decided to converge and become a super tumor. In addition to that, the fluid that I have in my lungs has decided to thicken and become hard, and I have new ground glass opacities and new tumors. So it didn't work. But I take comfort in knowing that this drug not only was not intended for the type of breast cancer that I have, but hasn't been proven to work on it. So the past 4 treatments were a wash. But in hindsight, I genuinely didn't expect this to work for my cancer. And if it had, it would have been a bonus. It would have been good for me and a great scientific test to prove it works for others that come behind me. So where do I go from here? The general consensus is that I should prepare for end of life. The general guess is anywhere from 3 to 6 months. Now, keeping that in mind, 9 years ago, I was told I had 1 to 3 years to live. And I just celebrated my 9th year of living with breast cancer throughout my body. So, where we go from here is tomorrow I have treatment as normal, but it won't be the trial drug. It won't be Trodelvy. It will be Gemzar, which is designed for metastatic breast cancer. And my hope is that it will prevent any further spread. And that's all I'm hoping for, is no further spread. But if I can get shrinkage and reduction in tumors and get a better result than what I'm hoping for, that will be amazing. I just want to stop it from progressing. To treat the thickening in my lungs, I also have in the upper lobes of my lungs a haziness evident on the CT scan that they believe is caused by a lung infection. So I've been taking antibiotics to treat that, and also a rescue inhaler because sometimes I cough so hard that I just can't breathe. And for years I've been saying that I cough in a way that sometimes my lungs burp. And for a long while, every doctor I've told this has looked at me like I'm insane. But I recently had my pulmonologist nurse tell me that there's a word for this, and it's called trapped air syndrome. People who have POCD, polycystic, the lung disease, not polycystic ovarian, the lung disease that you get from being a smoker or working in mines or being exposed to asbestos, have that where they breathe in an air and they can't release the carbon dioxide, whatever's released after you breathe in air. So it's good to know that all this time of being treated like that explanation of burping from my lungs, making me feel crazy for having that happen, even though my whole family and my friends have heard it happen, is actually real and I'm not crazy. And there's just a few small things that they can do to keep me comfortable. I'm on a higher dose of slow release pain medicine, and I have pain medicine to take for breakthrough pain because cancer is painful. And when I speak with the palliative care people, I'm sure we'll be talking about mental health. And I think I need to speak with someone because there's a lot going on in my brain that I just need to talk with someone about. Plus, at this time where I need to be focusing on myself and helping my immediate family deal with what's going on, there's people in my life who are pulling me away from my focus, and I just can't deal with that at all right now. So that is the update about what is going on with me. And I know it's a short video filmed on my phone, so it's not high quality, but I needed to get this out while I could say it and get it to you so you could be aware of it. If you have any questions, feel free to type them in the comments below, and I will answer as soon as I'm able and as openly as I can with the information that I have. I'm not a doctor, I'm a patient, so it's from a patient's perspective that I answer any medical questions that you have. Also, if you know anybody who is going through cancer, any kind of cancer, feel free to let them know that this video series from me is there. Maybe since so many drugs are used across lines of cancer treatment, maybe I've been on something that they're going on and they might have a question about it. Gemzar has the same side effects that pretty much all the treatments have. You could get diarrhea or you can be constipated. You could throw up or have no appetites. You could lose weight, you can gain weight. You can lose your hair, you probably will lose your hair. That's it. That's all. But before I go, I want you to know that as though I'm sad and I'm upset because this is shocking news, I still believe that nobody knows how long I'll be here. And just like the doctors 9 years ago saying 1 to 3 years, had no idea I'd be here in 9 years, nobody knows whether I'll be here in 3 or 6 months. So that's the hope I hang my hat on. Have a great day, and thank you for stopping by. Take a moment to thumbs up this video, like it, follow, subscribe, click on the bell. I appreciate you stopping by. Thanks.